participants from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And I'm here today chatting with Sarita Bennett about her upcoming presentation titled Ready, Responsible, Resilient, Handling Complications and Emergency. Welcome, Sarita.
Hi, well, thank you so much for having me.
I'm so glad to have you here with me today. I'm super excited about your upcoming presentation. But before we go into the topic itself, why don't you tell our listeners a little bit about yourself, your professional journey, and what you're up to these days?
Well, I started my journey into midwifery many, many years ago, listening to the stories that my grandmother told about my great-grandmother and how she kept her midwifery saddlebags and would often ride off into the night. And so having grown up in that kind of a culture and family, it was easy for me to be interested whenever I became pregnant in the late 70s and had my first baby in 1978. I think I was originally given some very old and now out of print birth books and began a career that by 1983 I was actively practicing midwifery illegally in the mountains of West Virginia, which can often be a very low resource and isolated geographical area. Over the next few years, well, really 12 years, I had three more babies, and that journey through that, my own foray into childbirth really taught me so much about what women need and what babies need to do best. After that, I was very much involved with the Midwives Alliance of West Virginia, having a lot of input into figuring out how to validate the profession and make it in a way that we could hold ourselves accountable, because we all understand that there's no such thing as a 0% infant mortality rate anywhere in the world. And although we have to do our best to get it as close to that as possible, we also had to know how to risk people out, how to be able to take responsibility for the choices that we did make, and then how to deal with our ability to learn and grow and continue to practice midwifery. Then after about 15 years of that practice, I went to medical school, osteopathic medical school. Many people don't know what an osteopath is, and I talk about it being a holistic healthcare provider. I'm a fully licensed physician who had the blessing of training with old-time family practice docs, especially one who had been in the missionary field and had learned how to take care of a vast variety of people, especially in women's health, and be able to do so in a low resource area. I was able to combine all of that knowledge and go back to my home in the mountains of West Virginia and open a family practice clinic. We bought an old building and bought used equipment and materials and went to work. And I continued to run that clinic, having also training medical students and particularly physician's assistant students to work with me over the next 15 years. After a period of time of really taking care of people from all walks of life and from, as they call it, from womb to tomb, you really begin to understand the patterns of human behavior and the basic needs that we all share. I then, about 5 or 6 years ago, moved with my family into the Charlottesville, Virginia area, and after a couple of years of providing home birth and teaching students, it became evident to me that a birth center in this area would do well and also provide more clinical education opportunities for students. So I took a big breath and found some investors who bought a house for me to run a birth center out of, and I continued to do that as well as provide home birth care. What we talk a lot about is that we may not really be a birth center so much as a birth sanctuary, and we often find ourselves working with people who have been traumatized by previous births, so we specialize in redemption births.
Thank you, Sarita, so much for sharing that. You have such a well-rounded and wonderful background here. And you mentioned that you come from a family of midwives, right? You come, from a family of midwives and tell me a little bit. You mentioned something in the beginning there when you were saying that you practiced illegally in the mountains of West Virginia. What was that like? I can imagine that was probably not easy, right? So can you tell our listeners
No,
a little bit about that time?
yes, Well, geographically it's difficult because the winters can be harsh and the roads can be windy, and there was no way out of my home county without crossing a mountain. As a matter of fact, it's called the birthplace of rivers because all of the water flows out. So we also had to deal with ice and sometimes floods and people who lived up back roads at least an hour, hour and a half away from any kind of hospital, and definitely from any kind of hospital with surgical capability. So one thing that you do is you get really, really good at knowing what to do and knowing what not to do, knowing how to see emergencies coming if possible, to be prepared for them, and then knowing how to transport, keep people stable, and to transport in a way that's timely and can avoid complications as much as possible. You also learn to become very self-reliant and use whatever resources are available to you.
And that really leads right into your presentation that you are presenting here at our Midwifery Conference 2019. And the title of that is Ready, Responsible, and Resilient Handling Complications and Emergency. I'm so glad you're presenting on this topic. I'm a midwife myself, and emergencies, we need to train for them. But whenever we think about the topic, whew, kind of, I feel my chest tightening. I feel like a little anxious but your title there, right there, because I've seen your slides. I can say that to our listeners so far. Our listeners are in for a treat. They're wonderful slides, and it's going to be a wonderful presentation. But they are right there. I feel like, okay, ready, responsible, resilient. This is something, a presentation I can really use. I get a lot of good information from it. So tell us a little bit about the topic, what you're presenting on, and what you think is important here.
Well, in 40 years of practice, I've certainly had the opportunity to have to deal with a lot of different complications in both in a in a small team or in a larger team setting. And what I tried to do with this presentation was think about, regardless of what the emergency was, what was the common theme that ran through how I could be more prepared, how I could be ready to take care of whatever that emergency is. And then especially in the tougher ones that have unfortunate outcomes, as I often call it, how you can learn how to heal that trauma within yourself and not carry it into the next birth as well as into your life. So it's really about how to midwife the entire process of birth, because it's easy to be at a normal birth, but it's those hard ones that either result in transport or result in having to use your skills to stabilize an uncomfortable situation. As you say, a heart pounding, kind of tightening your throat situation. It's really about what we can do no matter what those complications might arise, to be able to handle them in a way that not only works together as a team towards having an optimal outcome, but also how to handle those personal feelings and responses to that kind of situation within ourselves and move forward. So I've had an opportunity many times to sit through peer review processes with midwives, both ones that I knew well and ones that I didn't know well. And part of what I tried to bring to this presentation as well is the common themes that I've learned through listening to all of those countless stories of midwives whenever things weren't just fun and games, as I call it, when they weren't just proceeding normally and everybody went home feeling good about the situation.
That sounds wonderful. Thank you for sharing that. And I am looking forward to this presentation. As you said, it's to how to midwife the hard ones, how to also,
Exactly.
be there
And ourselves.
and ourselves,
Hmm.
exactly, handle those feelings
Yes.
and do what you're trained to do, right?
Right.
So thank you so much, Sarita, for sitting down here with me and chatting a little bit about yourself and the presentation. It was such a pleasure having you here with me today.
I'm really excited.
Thank you so much. The presentation Ready, Responsible, Resilient, and Handling Complications and Emergencies is part of the Gold Midwifery Conference 2019. And this presentation will be live on February 11th. To find out when this is in your time zone, please visit goldmidwifery.com. Thank you everyone for listening here with us today. Bye bye.